Good morning, Dr. Tam Ashley for CBC News. I'm hoping you can expand on what Dr. News said about immunity passports and certificates. Could it be effective?
So I think the answer is we don't actually know yet. I think just this last few days, we talked about the immunity task force, and some of the objectives of that task force is to conduct the necessary research in order to help us interpret what serological testing results mean. So by that, I said it is a very novel virus. We actually don't understand the immunology of this virus very much. We got some idea now about some of the antibody response, and some of these responses are quite delayed. We don't know when the sort of peak of the antibody response might be reached. We definitely don't know how long the antibody response might last for and what it means if someone gets reinfected. So all of those are unknown. The other unknown right now is also the performance of some of the tests, and that's partly related to the understanding of immunology, but each test performs differently. And so our National Microbiology Lab, having evaluated a range of tests, shows that a lot of them are not sensitive or specific enough, which means you could, in fact, get false positives where someone thinks they may have antibodies and they don't, or the lack of false negatives as well, and specificity. So those are sort of evolving knowledge. And so I think from our perspective, if you had a test, what we need to do is do these studies so that you know how to interpret that test. So I do think it's premature to sort of think about the concept of a passport.
I'm hoping you can talk about herd immunity. Quebec's premier has said that allowing a large number of non vulnerable people to get the virus naturally in Quebec would be the best defense against a second wave that could be potentially worse and even overwhelm the hospital system there. Do you recommend this approach to provinces and territories? Could it be the new normal?
I think part of the immunity task force is also to have a look at what the level of immunity is in our Canadian population. We actually don't know that. And I think, as we all appreciate, the number of reported cases is an underestimate of the number of people that have got the infection. So I think that is the first step. I think given the incredible public health response and the response of Canadians to do the physical distancing, it is possible that the level of immunity is quite low. And what I do know is that while this particular virus can have a very devastating impact on seniors, our elders, and those with underlying medical conditions, it can actually result in quite severe outcomes, even for the young and for the rest of the population. So, the idea of sort of generating natural immunity is actually something that is not something that I think should be undertaken. I personally think that we, as the chief medical officers, we would really be extremely cautious about that kind of approach. You never know if you, even as a young person, might get severely sick or get into the ICU. So it's not a concept that should be supported.
Rachel Haynes from CTV National News. My question is for Dr. Tam. We're talking a lot about the science behind antibodies, but we also know that a vaccine is what will help us return to the new normal, as the Prime Minister has said. How confident are you that a vaccine will actually be effective in combating the spread of this disease?
I think the honest answer is we actually don't know at the moment at all. I think that there are some promising candidates that are in very early development. And because we don't understand the immunology of the virus enough, it is a very premature, thing to even try to comment on, whether we'll actually get a vaccine. And then if we do get one, then how effective it is. The other thing that we don't know about is the evolution of this virus. What would this virus be like in another year? And how would that affect the effect of the vaccines are all unknowns. But what I am heartened about is the amount of research that is going into this at the moment.
And given that it's too premature to even be talking about the effectiveness of it, the Prime Minister has said multiple times over the last few weeks that we will only return to normal if we get this vaccine. But today we're talking a lot about reopening the economy. So is it premature to even be at that step right now when the science is so unclear at the moment?
Well, I think what is really important is absolutely focus on eliminating this first wave. That is really, really critical, and be very, very cautious about it. All of these outbreaks in these high-risk settings must be addressed. There must be plans to prevent further infections in long-term care homes, in acute care settings, in the sort of crowded living conditions. That actually has to be in place, as well as the testing strategies, increasing the number of tests. So there's a number of conditions upon which I think we can cautiously move to what I would call a new normal. So we're trying to balance very carefully the public health measures against disease activity. The moment that we're going to see some uptake in disease activity, you're going to have to be able to react to that and rapidly contain any of these outbreaks. So I think as we've observed, the epidemiology is quite different across the country. So there will be some differences in the timing, but tread really, really cautiously, because I think that the chains of transmission will be reignited very rapidly should we don't take absolutely great care as we come down that slope on the other side of the epidemic curve.